Hello and welcome to the Uma Show. As you all know, on the Uma Show I talk about everything to do with health, wellness, overall well-being and beauty inside out. I am a big advocate of feeling beautiful and nurturing our beauty. But I also have a lot of you always asking me questions about plastic surgery. So on today's show, I have one of the best aesthetic surgeons in Dubai who's going to talk about everything you want to know about plastic surgery. How interesting, isn't it? You ask and I have the answer for it. Dr. Maurizio, welcome on the Uma Show.
Thank you very much, Uma, for inviting me. It's a pleasure to be here with you.
It's such a pleasure and I've been wanting to talk to you for such a long time.
Okay, let's see.
Firstly, please tell me about yourself.
So, as you know, I'm a twin brother, together with my twin brother Roberto, and in 1990 we opened our first clinic in London, in Harley Street, London Center for Aesthetic Surgery. That is still running and we still go there every 3 months. I'm going there to London. But then in 2008 we opened here in Dubai Healthcare City, the London Center for Aesthetic Surgery, Gulf.
Well, plastic surgery, or as you call it, aesthetic surgery, is huge in this part of the world.
Yes, you're right.
What makes a doctor a good plastic surgeon?
This is a difficult question, but basically, if you want to last as a professional long time and to be here for, we cannot say forever, but for a good amount of years, you need to provide a good job. You need to provide a service, operation that they are reliable, that the patient are happy, that they can also, the patient rely on you if there is any issue, any problem, and be, most of all, honest with the patient. You need to tell the patient what can be achieved. You need to tell the patient what are the downside. You need to tell the patient what will be the recovery time. But first of all, also you need to tell the patient, you need to guide the patient to the most suited operation for that particular patient. So if someone wants the eyes done, but it's not the eyes the issue, but for example it's the chin or under part of the face or the body, you need to be able to guide the patient into that particular area and do what is the best for the patient. Yeah. So first of all, give a very good quality of job, be professional and do what you are capable to do. So stick on what is your specialty, what you are excellent on that, and don't try to please everybody and do also something that you're not very strong at.
So what are the surgeries you specialize in?
Okay, what I love to do most of all is body reshaping. So I love to do, for example, a lot of liposuction using the VIEL technique, then a lot of tummy tuck together with liposuction, and also breast augmentation and breast reduction, and then a facelift. That's what I do most of the time. And also together with fat injection, using also stem cells that will help to have a better result. But what we do a lot is this body contouring, body reshaping through vasolipo, and tummy tuck or thigh lift or brachioplasty, and a lot of breast augmentation.
What should we look at when we are looking for a good plastic surgeon?
But when you're looking for a good plastic surgeon, it's important first to hear what's going on, the noise, the rumor that goes around in the city. And then when also go online, there are a lot of patient blogs. And then you can also look in there, and then you can see also what are the feedback of the patient about this particular technique or particular treatment or operation. And then you get also a good idea. Then of course you need to look also the credential of the surgeon, how many years has been around. And then when you see the surgeons, don't be afraid to ask questions. Okay, because that is your right to ask questions. You can ask where I've been trained, how many years I've been doing this operation, ask if there is any issue, any problem, what we can do. And so this is, and then also feel your instinct. Because if immediately you feel that you are comfortable with a particular person, surgeon, doctor, and that is the most important. He understands you, you understand him or her.
Exactly, and that's so important to have, find that connect with your surgeon.
Yeah, correct. I feel that is important. And that's also because what I said before, we have to be able to listen,
Yes.
to understand the patient.
Yes. Plastic surgery is still considered a vanity in many different ways. What is your take on it?
But yes, plastic surgery could be a little bit of a vanity. But I always said all over the year that a little bit of vanity is no bad, actually is good, because if there is a little bit of this type of feeling, this vanity, that means that you are trying to take care of yourself. Okay, so that is a good, because if you take care of the way that you look, in a way you also take care of your health.
So how honest are you with your patients?
But I think that for me, to be honest, is one of my priority. I try to be, I don't do this profession because I want to make money or I want to know, because I want to show off. I do it because I love it. I do it because I want to improve the quality of life of the patient. And if I say no to a patient, I have to say no to the patient. I don't have any regrets in doing so.
Do you think most of the people after surgery get healthier in life? They start focusing more on their overall well-being?
But I think this is important because nowadays it's not only the outside that we try not to improve and make you looking beautiful, but it also goes from the inside. So to all our patients, we try to teach them how to eat healthier, how to exercise, how to change the lifestyle, and also to take maybe some supplements or other treatments that they can help to regenerate your body from inside. Because together with aesthetic medicine, now there is also the regenerative medicine that is in a way try to prevent and to slow down the aging process. So the two things, they go very well together. So I think that it's important also to change a little bit your lifestyle and to try to understand that the prevention and the regenerative medicine is a part of the all cosmetic, plastic surgery, aesthetic surgery.
Right. As you said in the previous answer, that a lot of people may go overboard with it at times. When should they stop, and when should they know that they've done enough and they shouldn't go overboard with it? Because you do see many cases where you think that they could have not done so much.
But you see, for the patient sometimes it's difficult to realize when it's too much, because you see yourself in front of the mirror, but you don't see yourself three-dimensionally. So it's important that or the doctor, your surgeon, has to be honest again with you and tell you when you've done too much. Or if you have real good friends that then tell you, okay, enough now, don't do anymore. And you need to be prepared to listen to them. But sometimes it's difficult because you have your own idea of beauty, concept of beauty, and you think that you're always right.
Absolutely.
But sometimes it's not the case. So sometimes also the patient has to listen to the people that they really care for them, and also to the surgeon when they say, enough, wait, don't do anymore. Right. Because they see you from a different perspective, and they have a better idea of how you look like.
Right. And I know for a fact that you're very honest, because when I came to you with my pigmentation, you suggested PRP, which is way more natural than anything else.
This is a good
and I really
treatment.
Appreciated that. So what are the treatments that are most popular in this city of Dubai?
Now, on the aesthetic side, on the aesthetic medicine, definitely Botox is still very popular.
Right.
Filler, they are still very popular because they're the most two important aesthetic treatment. But then also the PRP is getting more and more sought after. And also laser resurfacing also can help as well in this part of the world if it's done with caution, because yes, we have a lot of sun, so you don't have to overdo it. And then the other thing that is getting more popular on the surgical side is the body reshaping. And what they want here a lot is do buttocks augmentation, make the buttocks a bit bigger. Okay. Also the breast is still going very, very strong. But the number one is always body reshaping by liposuction.
Okay, that is the number one.
Yeah, because with liposuction, you don't only remove the fat and finish, but actually you change the shape of the body. So that is very important here.
Okay. And of course, that is something that most people are looking at if they are.
Yeah. Also because, here, especially, with the expat population, we live in a sunny, beautiful place, so you don't wear many layers of clothing.
Yeah.
And so they like to show a little bit. So they're very conscious about it.
Absolutely.
In fact, here in Dubai, it's more the body than the face. Compare instead with London. In London, it's more the face than the body.
Being an aesthetic surgeon, what is your definition of beauty?
For me, the definition of beauty is that beauty has to be unique for the particular person and has to follow certain proportions. Because not necessarily one type of beauty can fit everybody. Right. But to me, what is more important is to see the ensemble, the face, the eyes, the nose, the lips, the oval of the shape, put together and see which proportion are there. And that's, to me, create a more individual type of beauty. And then not necessarily, for example, a small nose is better than a little bit more important nose, if that fits the particular face. So everybody is an individual and they have their own type of beauty. But if you ask me what I like something that is sweet, kind look, and soft look. Yeah, that's what I like most as a beauty.
Right. What would be your message to men and women who would like to go in for any of these treatments?
The message is very simple. Don't be afraid. Do it when it's the right time for you. Ask the questions and be prepared. And most of all, do it for yourself. Don't do it to please anybody else. Because that is your body, is you that you need to live in the particular body, and you have to be happy with that. So it's important that whenever you do it for yourself. Do it what makes you feel happy. And also some little piece of advice, do it a little bit earlier than later. Because when you do it a bit earlier, the job is easier, it's not so dramatic in terms of change, and you can benefit for much longer time.
And you can keep maintaining it.
Yeah, and nowadays there are smaller procedures that they can buy you time to go to the bigger one.
Right.
And nobody can see a transformation from day to night, but instead they can see that you always look younger for many years.
Right, yeah.
So don't wait until the very, very last, but try to do a little bit earlier.
Amazing. Thank you so much,
Thank you very much.
coming on the show.
Really a pleasure talking to you.
Such a pleasure. It's a subject that I've been trying to talk about on my show, because my show is all about health and wellness, and I do speak a lot about inner well-being and inner beauty, but I know this is a subject that I need to touch upon, because obviously at the end of the day,
as I said also earlier, it's not only my knife that is important, but it's also what we are eating, our lifestyle, and we need to eat healthy. Forget the junk food, forget smoking.
Exactly.
Live healthy and exercise, not too much, but sensibly.
Yeah, sensibly, and it's a combination of the interior and the exterior, which is which makes us, beautiful in our own way. Thank you so much.
Thank you very much, Uma.